So let's talk about you as an injector. You already have medical education, whatever that is. You already have critical thinking skills, and you're already a lifelong learner, which is just required to have a medical education. So it makes sense that you would consider being an injector. What if you could take all your current skills and education and put it into a fulfilling career? What if you could control your schedule and treat patients who appreciate your skills and expertise? Here is just a breakdown of the difference between the mainstream medicine life and the aesthetic medicine life. So in mainstream medicine, you have patients that are reporting for sick care. They're ill. Many times they're not very happy. As you can see here, in mainstream medicine, patients are emotionally liable. How many times do you have an angry patient or been yelled at by a patient or seen? I can't tell you how many times I would consider it to be very abusive. Many of the patients that came in, just to staff members, and very demeaning and insulting. It's sad but true. That's what's happening. And then a lot of the patients in mainstream medicine actually prefer not to be treated. Many of them are there because they have to be there. If they had the choice, they would leave. If they didn't need to have care to save their life, they wouldn't be there. It's not like they woke up today and say, hey, I can't wait to go to the hospital today. They're there because of an external factor. But if you look at aesthetic medicine, totally different. It's the opposite picture. Patients only come for well care. In fact, if someone's really sick, you're not going to do aesthetic medicine procedures on them. But they only come because they're already healthy, they're already well. And then when they come, their emotional state is that they're usually very happy and excited. Like the people that you treat are people that are, they're obviously paying for this. They're excited to be here. It's something that they woke up today and they said, hey, I can't wait to get my Botox. They actually are interested in doing that. And the patients desire the treatments. You're not trying to force treatments down people's throats. You're not trying to argue with people to do what they need to do to get their health back. They actually want this. And so it's such a different lifestyle, and it's so important. These are some text messages that have come into our practice. Many of them are for my wife, Jennifer, who does a lot of great work with fillers. But basically, take a look at these and ask yourself, when is the last time you received any message like this from a patient you treated in mainstream medicine? I know for a fact, I never got any of that, and I treated thousands of patients. And I would get people that were very nice, they'd send cards or something like this, but it was so rare. In fact, many of the times I felt like as a practitioner in mainstream medicine, they kind of take you for granted. You're just supposed to do that. Oh, you're a nurse. You're supposed to do that. It's, your job. When you're in aesthetic medicine, people are so grateful. Take a look at this one. You're a miracle worker. I know I still have some time for this disboard to set in, but I have arches in my brows. No straight line brows touching my lashes. Thank you, thank you, thank you for listening to me. Wow. How would you be excited to see that patient again? I know I would be. Here's another one, basically checking on this patient here. Said, how's your face? Amazing. I'll send you pics in a few, but the Dysport already kicked in. 3 love faces. And then here's another one. Twice last week, I've had people tell me I look 5 years younger. Thanks for working your magic. I love that one. I love it when people, and one of the best things you can have as an aesthetic injector is when people tell you, nobody knows what I did, but they just tell me I look younger and healthier. And that means you hit the nail right on the head of that one.